Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I am sitting here on a Wednesday afternoon with my amazing co-host, Dr. Millicent Rovelo. Dr. Rovelo, how are you?
I'm doing pretty well. Doing pretty well.
Good. That sounds like you're doing well. I'm happy to hear that. And I think that pretty much establishes that you are doing
that
well.
I am well.
Or pretty well.
Or pretty well.
We're going to talk about something today that is a little bit, kind of drives me a little bit crazy.
What is that?
Not that anything else does that we've talked about on this podcast. So I'm realizing that this is mostly an opportunity for me to rant about certain things.
Yes.
About what I do.
Yes, and I'm here to support your rants. That is my role.
Thank you. But this is not, it's not just for us. This is for the patients too. I'm going to go out on a limb right now, because this podcast is about nostril asymmetry.
Ugh. That's a tough topic.
It is. But I understand it, and there's a reason we have to talk about it.
No, for sure. There definitely is a reason to talk about it, because we talk about it all the time.
All the time.
All the time.
Nostril asymmetry after rhinoplasty. Before rhinoplasty, nostril asymmetry is an issue. It's like it becomes a real issue after surgery because the nostrils have been surgically altered.
Yes, and because patients are looking at them.
For the first time ever.
Ever. I don't think I've ever looked at my nostrils. I mean, I've seen them, but I couldn't tell you what they looked like. Are they ovals? Are they circles? Are they asymmetric? Is one taller than the other? No clue.
You have no idea.
I have no idea, because you know why? I don't look at them.
No, that's right. But if you had rhinoplasty, you would.
All day.
All day long, because once people have something operated, they focus on it. And I will tell you that I understand you're having rhinoplasty and you expect everything to be totally perfect, which is totally impossible. That is never going to happen. There are deficits and problems after every single rhinoplasty. There will be defects. There will be issues. There will be asymmetries after every single rhinoplasty performed by anybody on earth.
Ever. Something about it
will be not perfect.
Right.
Because there's no such thing.
There's no such thing.
No one has a perfect nose.
But they can look pretty darn good.
But they can look normal. And they can look like they should look. And they can look like the nose that you were born with. And they can look amazing. The problem comes when patient expectations of what rhinoplasties to deliver is in a mismatch with what's possible to deliver.
Right.
And nostril asymmetry is going to be the case.
Yes.
Every time. Without fail.
And this can be in patients that came in with asymmetric nostrils, or there are some asymmetries that can come after surgery. All of the above are totally normal and happen to just about every patient.
The real problem comes with nostril asymmetry is when it doesn't look good, when it doesn't look right. So if there is a nostril asymmetry that is surgically induced and there's a surgical answer, that's when reoperation does occur.
Correct. Now, my question to you would be, are you talking about a surgical asymmetry that is present when you are looking directly at the patient, or a surgical asymmetry that you can really only see if you put your head all the way back and look straight up their nose?
It has to be something that is noticeable. I mean, because you can cause problems.
Of course.
I had a patient come in recently to have her 1 millimeter nostril discrepancy from side to side, even though her face is off by like 5 to 6 millimeters. Like the asymmetry of her face was tremendous. And when people look in the mirror and realize how asymmetric they are, they're like, oh.
Yeah.
Ooh.
Most people are pretty asymmetric.
Very much so.
Yeah.
I mean, I have cheekbones that are like, centimeter higher on one side than the other, and my jaw looks like one side looks like it has a tumor. And
this is why we have our good sides.
We have good sides and bad sides. Yeah. Right. So noses do too. The problem happens when people fixate on it and it's visible after surgery. So I do fix nostrils, but it's pretty rare. Most of the time I tell people, you kind of got to deal with that.
Yeah.
And you got to find a way to hang in there. You got to find a way to understand it. And
stop sticking your nose up in the air and looking at it with a mirror.
Yeah, because nobody does that.
Nobody in the real world is looking at your nose in that way.
No, I've never looked up my nose